I'm Tamiki. Thank you for stopping in to hang out with me today. I actually like that it's a little bit intimate, so I'm not going to complain about it at all. So hang in there with me. But I'm Tamiki Davis. I have a master's in clinical counseling psychology, and I'm currently working on my doctorate in clinical psychology. I am finishing up the first full year or third semester because we've been going year round. Thank you. Um, and it is at Brunel University. So I am working towards doctorate and plan to actually practice as a clinical psychologist once I survive everything. So I really appreciate that year, doctoral candidate, and it gives me a sense of comfort and pride to actually see someone who looks like me. So yeah, for you. Um, I actually am fully licensed here in the state of Georgia. I actually have my own practice, which is in so wellness. But currently, as I mentioned, I am seeing you as here as a doctoral practicum student, working under Dr. Tamara Edwards, who is a clinical psychologist, and she actually specializes in neurodivergent or neurodevelopmental disorders. So she, at her practice, works a lot with testing or assessments of individuals from kids all the way up through adults who actually have either or suspect that they have ADHD, autism spectrum disorder, ESD, or learning disabilities, which today we're going to be talking about ADHD and co-occurring learning disabilities. So, and the challenges that it presents. But I have the pleasure of actually working with Dr. Edwards, and I'll be there for a few more weeks before moving on to a different site. But in my practice, I've been working with individuals primarily who have ADHD, dealing with grief, anxieties, depression, so a wide range of things. I also work with a lot of individuals. Yes, there is definitely something interesting there. I agree with you. But I also work with a lot of individuals who are dealing with trauma or post-traumatic stress disorder. Also an EMDR trained provider, and I love using that and seeing how that helps individuals from all different aspects of issues. So we'll jump in there. One disclaimer that I want to actually mention today is that I may actually mention at some point how ADHD affects, I know I'll do this, how ADHD affects women and people assigned female at birth, regardless of their affirmed gender identity. So I'll use terms like girls and women for individuals who are either 18, under 18 if they're a girl, or over the age of 18. I may also refer to men and people assigned male at birth as boys or men for the same reason. And I just wanted to make sure that that was noted. Objectives are pretty simple. So we're going to have a general understanding of ADHD and its subtypes, general understanding of learning disabilities, some common symptomology associated with either or all of those disorders, identify some common ways in which learning disabilities impact daily life, understanding the importance of identifying and treating co-occurring disorders, and identify some available treatment options and strategies. Right. And at any point, if you have a question or something, feel free to jump in, or we can discuss a few things at the end. And again, thank you for hanging in there. We got ready to get started. Awesome. I'll see. Okay, so attention deficit hyperactivity disorder, or ADHD. Of course, it's a neurodevelopmental disorder. It typically manifests fairly early in life, especially by the time a child starts school. You're going to start to see some of the associated symptoms. It is actually a result of differences in brain processes, and it affects individuals in their personal lives. Let's see. I think we're seeing a different thing. Thank you for telling me. Because let's see if I can make this change here. You may have to leave it small, which is not ideal, but tell me if you give me a thumbs up if you can actually see me now. All right, let's see. All right, let's see. Awesome. All right, we like this. All right, if it stops again, let me know. We're gonna get it right together. So Give me a thumbs up if you can see me advanced now. I think what it's doing is keeping me from being able to see everything at the same time. Okay. All right, yeah, just give me a thumbs up, or if you need to, you can. Awesome. Right, right, right. Awesome. All right. Of course, I say that right as it stops. So let's see. There we go. All right. So as I was saying, ADHD shows up fairly early. It's a difference in brain processes affecting the individual's personal, social, academic, or occupational functioning, and or I should say. There are three subtypes. Predominantly impulsive hyperactive is the most commonly recognized subtype. That is what people tend to refer to when they think of ADHD. This is the usually I say boys because unfortunately it is who has gotten most of the attention when it comes to ADHD and research, diagnosis, all of those great things. So this is typically when they're seeing a person who can't seem to sit still, maybe bouncing off the wall, constantly doing things that seem a little bit dangerous. So this is the common form of, I'd like to say common or most common form of ADHD. There's also predominantly inattentive and distractible. This is the individual who is mostly inattentive or distracted. They have difficulty paying attention, following instructions, organizing tasks. Forgetfulness is a common thing that shows up, and there's difficulty with executive functioning in terms of organizing, making decisions, things like that. And then there's combined presentation where they get the lovely pleasure of having all of the above those things showing up. In terms of learning disabilities or specific learning disorders, today I'll probably refer to it most often as learning disabilities as it states in the title. But in terms of learning disabilities, it's also neurodevelopmental disorders that affects one or more of basic psychological processes involved in understanding or using language. And these things can manifest in cause significant issues affecting a person's ability to listen, to speak, to read, write, spell, or do mathematics. Typically, they're diagnosed in early school age children, but the person may not be diagnosed with a specific learning disorder or learning disability until they've reached adulthood. Now, when we consider undiagnosed learning disabilities, usually exacerbate challenges in individuals with ADHD or vice versa. So, ADHD and learning disabilities, they often go hand in hand with. Oh, there you go. Hello and welcome to join. I can't see who's joined, but let me know if you can see the screen or hear me. Right. So, when ADHD coexists with a learning disability, it's going to combine a broad executive function impairment that is seen in individuals. And then there are lots of deficits that are noticed. Usually they're going to be specific to reading, writing, or math. So ADHD on its own, of course, actually affects around 5% of children, and it's expected that at least 2.5% of adults who are impacted by ADHD globally will still have impairment related to that particular disorder when they reach adulthood. Right now, according to the DSM and diagnostic criteria, we expect or we've learned that between 30 to 50% of individuals with ADHD also have a co-occurring learning disability. The comorbidity rates range between 5 to 15% worldwide, and specific learning disorders or disabilities actually are one of the most common neurodevelopmental disorders in children and adolescents in itself, affecting up to 15% of the population across different languages and cultures. The DSM 5 and 5 TR also They define three types of learning disabilities, and these are focused on deficits in reading, writing, and mathematics. Although ADHD is not a learning disability, it can significantly impact learning. So just imagine all of those things boiled up into one. It's kind of like a perfect storm to impair someone's ability to actually learn and be successful in especially academic settings, but on throughout life. The comorbidity rates for isolated and combined specific learning disorders are pretty similar, even when there are cutoff criteria or strict cutoff criteria applied. We found that boys actually tend to show more spelling deficits, which is an interesting stat that I came across, while girls seem to be more impaired in arithmetic. There are no gender differences that have been observed for isolated reading problems or the combination of all three gender disorders. I did come across a study that was interesting, or some stats that were interesting from a survey that was done a while ago. So I want to look at this, and if I find additional stats, I'll be sure to add it to the appendix for this particular presentation, but this was as of 2011, and it was based on stats that were from 2007 that said that 33% of the children with ADHD had one coexisting condition of a learning disability, and 16% had two or more. 18% had three or more, which I found this astounding and a bit scary if you think about it. And this was comparing, of course, or looking at the comorbidity specifically between ADHD and specific learning disorders. Okay, when we think about what actually is causing the comorbidity, there are several possible explanations. Some of them look at genetics or origins. Origin of both ADHD and learning disabilities involve neural network disruption. So we're looking at what's going on in the brain and developmental or the development of the brain. Um, there is a possibility that there may be specific genes that are contributing to both of those disorders commonly occurring together. And there's also the possibility of this being caused by some type of prenatal exposure, perhaps certain toxins or the effect of maternal stress while babies being carried in the womb. Um, there are shared underlying mechanisms, of course, in the brain development, and this could possibly be contributing to both connections on a um, from a neurobiological standpoint. So let's look a little bit closer at common co-occurring learning disabilities. The most common ones that you'll hear are going to be um, the ones shown here on this slide: dyslexia, which involves difficulties in accurate and fluent word recognition. So it's problems with fluent word recognition or accurate word recognition. Um, the person may have poor decoding skills or poor spelling. Dyscalculia, which is one that is starting to has in the past few years, I think has gotten more attention, and I'm glad that it is getting more attention because I think that it's been often overlooked. Most people think of dyslexia when they think of learning disability, at least people I should say that I've encountered in my personal life and career. But dyscalculia is focused on um, impaired mathematical abilities affecting number sense and problem solving. So this is difficulties processing numerical information, learning arithmetic facts, understanding math concepts, and performing accurate or fluent calculations in math. Dysgraphia is related to challenges in writing, including poor handwriting, organizing thoughts on paper. It's like turning thoughts into written language is where the impairment is seen. So it's usually comparative to what should be typical for that person's age and cognitive abilities. So it's really seen in terms as well as trouble organizing thoughts on paper. There also is specific language impairment or language delays. So there could be difficulties in language comprehension and expression. So difficulties with grammar and maybe limitations in vocabulary. It's another way that impairment shows up. And let's look at the real life impact of ADHD and ADHD and these comorbid learning disabilities. So when we consider the learning disabilities and kind of take a look there, that dyslexia starting off with that area. So as I mentioned, is struggling with reading fluency, comprehension, and decoding words, or difficulty recognizing sight words, or just following complex sentences. So this person may actually have a slow reading speed and have problems with comprehending what they just read. They could struggle with spelling. They may have difficulty with writing tasks and note taking in class. Um, with dysgraphia, that's also directly related to writing difficulties. So there's poor handwriting that's often hard to read, causes a lot of frustration. I'm just thinking about personally the impact of having to turn in assignments and maybe have your grades impacted or your work, how you're performing in your career actually take a hit basically because the person that is reviewing your work is having difficulty understanding what you've written down. So, of course, it causes frustrations, difficulty in completing written assignments, also related to difficulty in organizing ideas into written form. When we look at dyscalculia, there's a difficulty there in struggle with basic arithmetic, understanding mathematical concepts, solving word problems is going to be more difficult. Difficulty memorizing things like multiplication tables when you think about children who are going to actually possibly be demonstrating some of the deficits that are associated with learning disabilities. This is one way that it shows up when they're at that stage of around, I guess, like second, third grade, I think is when they usually do try to memorize multiplication tables, or when they're trying to understand fractions, it becomes much more difficult than what would be considered a neurotypical child. So there's also struggles with things such as time, measurement, spatial reasoning. And so daily tasks, for instance, in your adult life, like budgeting or reading maps, those things become really hard or may even feel like they're impossible. Now, when we think about ADHD, of course, students with ADHD struggle, and please forgive the typo there, but they struggle with attention, focus, and organization in the classroom. Relationship difficulties may be experienced as they get older or reach adulthood, and if they're still dealing with some of the deficits associated with ADHD. And those relationship difficulties may actually show up due to the person who is affected or impacted by ADHD, demonstrating forgetfulness, being distracted, having difficulty listening or following along in relationships. So that can cause a strain. Impulsivity can also lead to impulsive decisions that result in overspending or risky behaviors, interrupting other people during conversations. There's time management issues because adults with ADHD often face difficulties managing time. They might be late for appointments, miss deadlines, or they may just struggle to actually prioritize tasks. So if we think of how these things may actually show up in someone's lives when we have ADHD occurring with a learning disability, students with dyslexia might actually struggle with focusing during reading assignments. They also might find it difficult to decode the words. So this is going to again impact their performance in the classroom. There's a double challenge, a double-edged sword, if you will. So you've got both ADHD and a learning disability. There's a struggle to focus perhaps during these assignments and also with the decoding. So they're working against each other almost. An adult with ADHD and dysgraphia, for instance, may struggle with both time management and expressing their thoughts in work. So if they're still a student, this is going to impact their performance in their schoolwork, their academic or career setbacks could actually occur because it also impacts self-esteem and motivation. Some of those things that aren't often mentioned when we're looking at how ADHD or learning disabilities, whether together or separate, how they might impact a person. So why is this important to consider? Of course, it is impacting, as I've mentioned, not only the child or the adult who has ADHD, a learning disability, or in this case, a co occurrence of those things. It does not only impact their academic achievement, but it also can impact their social development. If we think of how a child, for instance, is struggling to keep up with classmates in when they're starting school, because typically learning disabilities show up once a child starts school. once they're actually in schools, especially when they, for instance, with dyslexia, shift from learning to read, which they've done in the earlier years of school, but around third, fourth grade, you're now reading to learn. So there's a shift in that sense, and that's when we start to see more of dyslexia related issues show up. Um, so it's going to impact not only performance, but you start to internalize, which is something that is also common with ADHD. So you internalize these issues as you compare yourself and your performance to your cohort, your classmates. In work, you're comparing your level to perform, of course, with your coworkers. And this is something that the person affected may be doing on their own, but it's also something that is commonly done in terms of evaluations that are held like on a monthly or quarterly basis, depending on the type of career they're in. For this reason, early identification is crucial. For a child, you want to set them up for success from the beginning. So, um, actually getting to a point where you can actually recognize this and get them the help that they need with personalized treatment planning is very, very important and crucial to their success. I was able to find that there are some really good studies that are out recently, and one of them was actually comparing um, in individuals with co-occurring learning disabilities and looking at how to promote academic success for college students with ADHD and learning disabilities. So there's a lot of research that's come up. One of the most recent ones that I saw was a study that's being published this year, and it was actually comparing self-esteem and quality of life in 8 to 12-year-old children with ADHD. They looked at and compared in these children who had ADHD and fell in that age range with ADHD diagnosis only, comparing their self-esteem levels and quality of life with ADHD children who also had co-occurring learning disorders. And the goal was actually on emphasizing the importance of attention and diagnosis in children with ADHD. In this particular study, there were 120 children who were participants. 51% of the students were boys because, as we know, with ADHD, historically, it has been something that has been more prevalently studied in boys, and the impact of it on females is just recently becoming more of an attention now. And there's a long way to go in terms of catching up with research and what is available. But children with ADHD and learning disabilities actually reported significantly lower self-esteem and quality of life when they were compared to those students or individuals who actually only had a diagnosis of ADHD. So early support can contribute to improved self-confidence, as well as reduce symptoms of anxiety and depression, which we know are commonly co-occurring disorders with ADHD, as well as with an individual diagnosis of a learning disability. So when we consider what treatment and support options are available, psychological evaluation or neuropsychological evaluation is crucial. Proper diagnosis and having tailored intervention strategies are going to be key to helping the individual who is impacted by both ADHD and a learning disability. So tailored assessments help identify the symptoms of both and not just one or the other, of course. In terms of treatment, there are lots of treatment options that are available. And of course, the tailored assessment helps to guide in terms of what type of treatment and help you to address issues related to both conditions simultaneously. Counseling or psychotherapy is going to help with the emotional support as well as help to teach the affected individual about specific coping strategies based on some deficits or difficulties they may be experiencing in their own life. Coaching, ADHD coaching works on strategies, including helping the individual learn how to better manage their time, organizational skills, specifically whatever it is that is impacting them, because not every person diagnosed with either or both of these types of disorders are going to present in the exact same way. When we think of medication treatment, there are medications, of course, available to treat specifically the things that are related to ADHD, such as attention and focus, but there's also medication options available to treat accompanying mood disorders like anxiety, depression. There's not medication specifically for treating one of the learning disabilities, but because these disorders overlap, and the ADHD symptoms, of course, may exacerbate what is happening in terms of the learning disabilities and vice versa. If we treat the ADHD symptoms in that instance, or maintain or improve, rather improve what is happening in terms of anxiety and depression, it gives a better chance for any specific interventions, or support options that are being provided to address the learning disabilities, gives a better chance of success for those things. All right, in terms of what can we do, one of the reasons that you're here today, of course, hopefully, is to have a better awareness of the fact that these things are most likely occurring together. Better awareness of the fact that ADHD and learning disabilities often show up together, and getting, just an introduction to how their comorbidity or their co-occurrence actually impacts individuals. You're doing something about it by increasing awareness, and that's going to help to impact not only individuals that you may encounter in your work, your practical work or clinical work, but it'll help to kind of spread the word, because approximately 31 to up to 50% of children with ADHD also have a learning disability, and vice versa. We know that boys with ADHD have about a 65% risk of having writing disabilities when they're compared to other boys without ADHD. And this is the same, there's about a 57% risk for females or girls who actually have ADHD to actually have a co occurring disability, such as the writing disability as well. So, awareness of the comorbidities and their impact on anyone, that's a start. Address the internalized symptoms. If you are working with someone in a clinical setting, for instance, and providing psychotherapy, um, address the internalized symptoms. Address symptoms of like shame or questioning, or things that are affecting their self-esteem, because of difficulties they're having due to ADHD and learning disabilities. And advocate. If you come across someone, or if this is you who actually feel like, oh, well, maybe I'm actually someone who is suffering in these ways, then you want to advocate not just for yourself, but for anyone that you're working with, that they get the proper assessment and diagnosis, so that strategies can be introduced to help them improve their quality of life. That's really the goal of this. All right, so this time I will actually stop sharing my screen and open the floor if there's any questions that I might be able to help with. I'll do my very best. I'm not an expert by any means, but I am open to try. Right? If there's not any questions, I just want to take time to actually thank you for attending. Take time to taking time out of your busy day, and just let you know that we do offer services for ADHD evaluations, ADHD coaching, and counseling are all available at Magnolia Wellness and Psychology with Dr. Edwards Practice. So if you know anyone, or if you yourself need any assistance, feel free to reach out. We'll be glad to help.